What does a chiropractor do? Hey folks, Dr. Jeff Williams here, and I'm a fellowship-trained chiropractic orthopedist, and I own Creekstone Integrated Care right here in Amarillo, Texas. The question of what does a chiropractor do is big. The reason it's a big question is that there are so many different kinds of chiropractors in the world. The chiropractic profession, if I'm being honest, is not very standardized. For example, if you go to the doctor with an ear infection, pretty much in any part of the world, you pretty much know what treatment you're going to get. If you go to a chiropractor, just one to the other in the same town, you have no clue what you're going to get. Now, some folks think that that's a great thing. There's a chiropractor for everybody. Others think that that's not such a great thing. You ought to be able to know somewhat, on some level, what to expect when you go. But that's not the way chiropractic is right now. So, some chiropractors will see you a short amount of time, maybe a trial treatment, right? They'll teach you to self-manage any aggravations of your pain, get your condition resolved for you, and move on down the line until you need us next time. Now, I call these evidence-based, patient-centered chiropractors, like me. We're very much involved in helping patients learn to move better and learn to move overall, to feel better, to understand what hurts and why it hurts, and then to help our patients understand how they can do their part to control the pain on their own at home. Unless they really, really need us, of course. I basically live here at the office. Not really, but sometimes it feels that way. Now, some chiropractors, on the other hand, will take x-rays and based on the x-rays convince you that you need to be seen 30 or 40 50 or more times at a cost of thousands and thousands of dollars, and will set up a system where you are mostly dependent on them and their clinic. They tell you they're going to fix your allergies and your asthma, maybe even your cancer, and don't vaccinate your kids and all of those things. Now, obviously, you can tell by the way I am talking about this is not the type of office I recommend for you. But that is just my opinion. But that's the first hurdle to jump. Picking the right kind of chiropractor. I'm not saying this so that you go and avoid chiropractors, not at all. Quite the contrary. It simply means avoid that kind of chiropractor. The right, evidence-based, patient-centered chiropractor can absolutely be a part of your healthcare team and can change your life in a very positive way. I'm just saying, do your homework before you choose one. Now, back to the question of what does a chiropractor do? Well, let me begin this part of the video by saying that chiropractic is a profession. It is not a treatment modality. Chiropractic does not mean popping bones. Otherwise, we also call the popping bones spinal manipulative therapy. Chiropractic does not mean spinal manipulative therapy. Chiropractic has a lot of things that fit under its tent. Treatments like spinal manipulative therapy, like we just mentioned, popping bones, moving bones, all that good stuff. And spinal manipulative therapy is the cornerstone of most chiropractic offices, including mine. Next, we have exercise rehabilitation. Exercise rehabilitation, this is physical therapy-like activities that really help our patients stretch and move in a more functional way and heal faster than they would without them. Also, we have instrument-assisted soft tissue manipulation, which this is really using tools to help stretch and get out, work out muscle spasms, much like the Graston technique, if you're familiar with that at all. Many chiropractors also have massage as part of their treatment modalities. And we have, here at Creekstone, we have 4 incredible massage therapists, and they perform all kinds of techniques to help our patients. I commonly say that my job as a chiropractor is to take care of the frame, the frame of the body, and to make sure it's moving properly. While our massage therapists, their job is to take care of everything attached to the frame and make sure that it's functioning the way it's supposed to. Also, a very, very important team member here at Creekstone and many other chiropractic offices is an acupuncturist. We have an excellent acupuncturist here at Creekstone, and while they are trained in all sorts of Eastern medicine techniques, Western research has shown very significant effectiveness for acupuncture in treating headaches, migraines, chronic pain of all kinds, and stress and tension disorders as well, most notably PTSD. Now, a lot of chiropractors, including myself, also have low-level laser, also known as cold laser. Chiropractors have been using low-level laser for years and years now to help patients reduce inflammation, increase blood flow, and recover from injuries and sore joints faster. We also have balance and proprioceptive training here. We also have non-surgical spinal decompression. Y'all, seriously, decompression helps treat herniated and bulging discs better and safer than anything else I have ever seen on the market, plain and simple. End of story. Decompression is a game changer. Sports preparation and recovery. Lots of chiropractors focus on sports. And I just have to say, there's a reason that every professional sports team has a doctor of chiropractic as part of their staff, working as a team with orthopedic surgeons, athletic trainers, and all the rest. Now, that's just naming some of the treatment options a modern, evidence-based, patient-centered chiropractor utilizes as part of their toolbox. But as mentioned, spinal manipulative therapy is what chiropractors are mostly known for, moving and popping bones. And I'll be honest, chiropractors love the sound of those popping bones. And most of our patients, they love it too. But what exactly does this do to help a patient? Well, the thrust a chiropractor applies is called high velocity, low amplitude treatment. Commonly it's shortened to HVLA. And we cover the more complicated and technical version first here in this video, and then I'm going to boil it down for you to the really easy to understand version. You never know who's going to watch this, so we might as well cover both versions, right? So stick with me and let's start with the complicated version, okay? According to Dr. Malik Schlossberg, in his article for Dynamic Chiropractic of July 29, 2010, a joint that is injured, inflamed, degenerated, restricted in motion, or painful results in reflex inhibition, delayed activation, and progressive atrophy of the multifidus muscle innervated by that segment. By clinical examination, the chiropractor identifies the lesion and then applies an HVLA thrust to the joint. And this high-velocity force rapidly stretches the segmental ligaments, the joint capsules, intertransversarii, and interspinalis muscles, and intervertebral discs, and intensely stimulates their numerous stretch receptors. This results in ligamentomuscular reflex activation of the multifidus, which attempts to stabilize the joint and protect it from possible injury as a result of the high-velocity stretch. The segmental multifidus, which has been reflexively inhibited and is atrophying, is stimulated to contract. Now, this may reverse the reflex inhibition, progressive atrophy, and delayed muscle response documented to occur in the segmental multifidus, which overlies a dysfunctional joint, and restore dynamic function and contractility to this primary joint stabilizer. Or, if you wanted to beef it up, it activates a cascade of neurophysiological changes that mostly work together to decrease pain and inflammation while improving tissue recovery and area neurological mechanisms through various cytokines and other chemical mediators. Now, the easy version, how about that? This is much easier for everyone to understand. For your back, or any joint for that matter, to function correctly and without pain, it needs two things. Number one is mobility, and number two is stability. Mobility, stability. Some patients actually need strengthening and stability rather than more movement. Many chiropractors just pop anything and everything. But if a person needs stability rather than mobility, the adjustments that the chiropractors keep on doing could be doing harm rather than good. It is important to go to a chiropractor that knows when to mobilize and when to stabilize. And simply put, it needs WD-40 and duct tape. Okay? Mobility, stability. Adjustments, spinal manipulative therapy, popping bones, that increases mobility, the WD-40. And your exercises that we prescribe to you and the strengthening activities, those increase stability. That's the duct tape. Now, according to the best research, a spinal adjustment does the following for the recipient, okay? Firstly, it acts as a natural analgesic, much like ibuprofen. Also, it decreases venous stasis, which means it increases blood flow at the segment treated. This increases healing potential, but it also creates more space in a potentially confined space. Spaces where every millimeter can absolutely make a difference. It increases the descending pain inhibitory complex. Now what this means, stick with me, don't go anywhere. What this means is fewer pain signals are allowed to actually make it up into the higher centers of the brain to process for pain reasons in the first place. So if the trigger's not even getting up to the brain for processing, well then there's not as much pain going on, if that makes sense. Now also, finally, it increases proprioceptive information. So proprioception is our sense of where our body is, what position our body parts are in without us having to look at them, and how they move with each other and interact in space, right? Spinal adjustments help our brains to recognize the bones and the parts of our back and the joints more clearly, which allows for better, more functional movement from the top down. Now, this is especially important for chronic pain sufferers. Those suffering from chronic pain have a smudged map of their joints inside their brain. And that means the bones don't always move efficiently. There's aberrant, irregular movement. Now, these people commonly hear pops and cracks and maybe even grinding, but through spinal adjustments and encouraging healthy movement in the joints, they commonly have that little brain map gets cleared up, and less aberrant movement is going on as a result. Now that's the long and short of it. At the end of the day, the question of what does a chiropractor do can be answered shortly by saying, a lot. They do a lot, folks. And understanding that back pain is the #1 leader of the reasons for disability in the world, globally. Back pain is the #1 reason for disability. Once we know that, well then the most important thing a good evidence-based patient-centered chiropractor can do is to change lives. And we do it just about every day. Again, I'm Dr. Jeff Williams with Creekstone. If you are from the Amarillo, Texas area, or you're going to be traveling through and you need to be evaluated and treated by us, call us at 806-355-3000 and get on our schedule right now while you're thinking about it. If you're watching this on YouTube, go ahead and hit that subscribe button so that you don't miss any more fact-filled videos. If you're watching on Facebook, you know how this works. We'd appreciate you hitting that like button and share this video with your own network. It can make a difference for other people, and that makes all the difference in the world. Until next week, again, I'm Dr. Jeff Williams. Y'all stay safe.